How do you understand cervical cancer? Types from a pathology report. When you look at a pathology report for cervical cancer, it might seem like a lot of medical jargon, but it actually contains key details that help doctors understand exactly what kind of cancer they are dealing with. The report tells us about the type of cancer, how deep it has invaded the tissue, and other important features that influence treatment and prognosis. The most common types of cervical cancer are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma starts from the flat cells lining the surface of the cervix. It makes up the majority of cases and can be further classified into subtypes like keratinizing or non-keratinizing, based on how the cells look under the microscope. Adenocarcinoma begins from the glandular cells inside the cervical canal. Although less common, its occurrence has been increasing over time. Pathologists often describe adenocarcinomas using systems like the Silva pattern, which looks at how the tumor invades surrounding tissue and its association with high-risk human papillomavirus, or HPV. The report also indicates how deeply the cancer has invaded the cervical tissue, which is crucial for staging. If the invasion is limited to the surface or just the inner layer, it is called microinvasive carcinoma, usually classified as stage 1. Microinvasive cancers are divided into two categories based on how deep the invasion is, with stage IA1 being less than or equal to 3 mm deep, and stage IA2 being more than 3 but less than or equal to 5 mm deep. If the tumor has grown beyond that, into the surrounding tissue, or is visible to the eye, it is considered invasive and classified as stage 1 or higher. The size of the tumor also matters, with smaller tumors often having a better outlook. Another important feature is lymphovascular space invasion, which means cancer cells are found in the blood or lymphatic vessels within the cervix. While this does not change the stage, it indicates a higher risk that the cancer could spread to lymph nodes or other parts of the body. Speaking of spread, the report may include information about whether the cancer has reached nearby lymph nodes or other tissues, which helps determine the stage more precisely. Since most cervical cancers are linked to high-risk HPV types, especially HPV 16 and 18, the pathology report might note HPV status or related biomarkers. For adenocarcinomas, the Silva classification helps describe the pattern of invasion and HPV association, which can give clues about prognosis. The report also describes how abnormal the cancer cells look, called the grade, which can influence treatment choices. Finally, the report often includes staging details based on established systems like the FIGO or TNM systems. This includes whether the cancer is confined to the cervix or has spread beyond, such as into the vagina, surrounding tissues, or lymph nodes. It may also mention if there are precancerous changes like high-grade intraepithelial lesions or adenocarcinoma in situ, which are early signs of potential progression. In summary, understanding a cervical cancer pathology report involves looking at the type of cancer, how deeply it has invaded, its size, whether it has spread to lymph nodes, and its association with HPV. These details help doctors decide on the best treatment plan and give an idea of the likely outcome. If you ever receive a pathology report, remember that your healthcare team is there to explain what it means for your specific situation. Always consult with your doctor for personalized advice and guidance.